Good evening, everyone. I'm Chrisha Alagaratnam. I joined the Trust in May earlier this year, taking over from John Sargent. Our performance against the key finance targets for 10-11, the Trust achieved a surplus of 3.3 million and a cumulative break-even surplus of 5.2 million. The Trust external financing limit was 1.6 million and the Trust remained within its EFL and undershot this by 3.2 million. The Trust kept within the capital resource limit of 14.1 million and generated an underspend of 2.7 million. The Trust kept within the 3.5% capital cost absorption rate, resulting in a dividend payment of 4.7 million. The Trust achieved settlement rates of 75% to 85% in terms of volume and value respectively of public sector payment policy against a target of 95% to settle creditors within 30 days. The Trust has achieved a surplus of 3.3 million in 10-11 and Trust total income for that year was 334.8 million. 299.2 was for revenue from patient care activities and 35.6 was for non-patient care services such as training, education, research and development. In 2010-11, 74% of the Trust income was from NHS Sutton and Merton and NHS Surrey. So a vast proportion of our income comes from these two PCTs. The Trust spent 331.5 million in 10-11, 217 was spent on staffing alone, and 56.9 million was spent on services in relation to direct patient care. However, looking forward to 11-12, as Matthew's alluded to earlier, financial position is quite challenging, and we have a forecast deficit of 14.3 million. And as you can see from our waterfall here, we start the year with 3.3 million and predicted a deficit of 14.3 million. And this is partly due to managing an underlying deficit position and additional efficiency requirements from local commissioners. Before factoring the benefit of quality and cost improvement programmes, the Trust had a challenge of 38 million. The quality and cost improvement programme from the Trust is 18.7 million. And their initiatives such as transforming workforce efficiency, improving the patient pathway, improving theatre efficiency and reducing cost of temporary staffing. So our financial priorities going forward, we need to deliver a target deficit of 14.3 million, we need to deliver 18.7 million pounds of savings. We must extend current business plans and address the challenges in 12-13. And we've got to implement financial systems to support the transaction process. And finally, we need to work closely with local commissioners on demand management and reinvestment on community-based care.